This video summarises a Cochrane review by Catherine Granger and Vin Cavalieri titled Preoperative Exercise Training for People with Non-Small Cell Lung Cancer. Lung cancer is a leading cause of cancer death globally. Surgery offers the best chance of cure for people with early-stage non-small cell lung cancer, but it's associated with a risk of complications, including post-operative pulmonary complications. It's unclear if exercise training before surgery and any potential improvement in exercise capacity may translate to improved outcomes after surgery. This Cochrane review is an update of the initial version published in 2017. The primary objectives of the review were to evaluate the benefits and harm of preoperative exercise training on postoperative outcomes, such as the risk of developing a post-op pulmonary complication and the duration of the postoperative intercostal catheter in adults scheduled to undergo lung resection for non-small cell lung cancer. The secondary objectives were to determine the effect on length of hospital stay, symptoms, exercise capacity, lung function, and mortality. Randomised controlled trials in which study participants who were scheduled to undergo lung resection for non-small cell lung cancer were eligible. Preoperative exercise training was the experimental intervention. This was compared to no preoperative exercise training as usual care. The primary outcomes were the risk of developing a post-op pulmonary complication, the post-op duration of the intercostal catheter or drain tube, as well as the safety of the intervention. There are a range of secondary outcomes, including post-operative length of hospital stay, post-intervention, so pre-op, fatigue, dyspnea, exercise capacity and lung function, as well as post-operative exercise capacity and post-operative mortality. The following databases were searched to identify randomised control trials. 2 authors independently examined the studies for inclusion, and the search was performed from the date of the prior Cochrane Review search up until November 2021. For the measures of treatment effect, for the primary outcome, risk of developing a post-op pulmonary complication, risk ratio was used. For continuous outcomes, the mean difference was used, and 95% confidence intervals were calculated. 2 authors independently appraised the risk of bias of included trials using the Cochrane's 7 evidence-based domains table. To interpret findings, a grade summary of findings table was created, and the certainty of evidence for each outcome was assessed by downgrading or upgrading the evidence according to the grade criteria. The review included 5 studies or 5 trials from 12 papers in this current version, in addition to the original version, which had 5 trials and 8 papers. Therefore, in total, this Cochrane review included 10 trials from 20 papers. The characteristics of the intervention, the preoperative exercise training program, varied across the trials. The frequency ranged from 3 times a day of exercise training for a 1-week program up to 5 times a day of training for 4 weeks. The programs all included aerobic exercise, plus a combination of other types of exercise training as well. And the control group did not include an exercise program, although 2 of the trials included education around lung expansion and mobilisation. For the primary objectives, the review found that preoperative exercise training results in a large reduction in the risk of developing a post-op pulmonary complication compared to no preoperative exercise training. And what this found was, compared to a non-exercise group, the relative risk of developing a post-op pulmonary complication was reduced by 55% in the exercise group. And the certainty of this evidence was rated as high. This means it's expected that 1 fewer person will develop a post-op pulmonary complication for every 5 participants receiving the exercise program compared to usual care. The evidence is very uncertain about the effect on intercostal catheter duration. The preoperative exercise training likely results in a reduction in hospital length of stay afterwards by approximately 2.2 days, and the intervention was found to be safe. In terms of secondary outcomes, preoperative exercise training was found to be likely increases post-intervention exercise capacity measured by VO2 peak by a mean difference of 3.4 millilitres per kilogram per minute. The evidence is very uncertain about the effect on exercise capacity measured by the 6-minute walk distance, and it's likely results in little to no effect on post-intervention FEV1. In conclusion, preoperative exercise training for patients with non-small cell lung cancer results in a large reduction in the risk of developing a post-op pulmonary complication compared to no exercise, and it may reduce post-operative length of hospital stay and improve exercise capacity and lung function.